exchange session. So for this session, we will be focusing on climate justice and One Health and its intersection with pandemic preparedness and response. So I'm RJ Nagit. I'm the Knowledge Hub facilitator for Lessons or the Learning Exchange sessions. So Lessons is a component of the Communities in Pandemic Preparedness and Response, or COPPER, under the COPPER project implemented by the Activist Coalition on TB Asia Pacific, hosted by APCASO, and the Africa Coalition on Tuberculosis, supported by the Global Fund. So this webinar is co-hosted by the Regional Learning Hub of Anglophone Africa and the Preventing Zoonotic Disease Emergence, or PREZONE, and the Centre de Coopération Internationale en Recherche Agronomique pour Développement, or CIRAD. So for this session, we'll be adopting the following webinar guidelines. So I know some of you might be familiar with this already, but the session is, as you can see, is recorded. And if you can change your name to your name, your pronouns, and your organization, that would help us identify you during the Q&A session later. So if you're not speaking, kindly mute your microphone and turn on your camera so that we can have a more engaging experience. Throughout the webinar, you can also use emojis or use the raise hands function to interact with the speaker. Later on, we could have the chat box or the Q&A function set up so that you can also ask your questions in advance. So you can also raise concerns regarding technical difficulties on the chat so that we can address it appropriately. So this session will be conducted in English and in French. And also, we want to make sure that this is a safe space for everyone. So let's do our best to make sure that we contribute to that. And as always, ask questions, learn, and also after the session, we also invite you to share your insights to your colleagues and friends. So just to start our session, we prepared a short activity for you. So you can see on the screen a QR code. You can also go to menti.com and enter this code. And then we'll be sharing the answers to the questions later. So Mook, can you share screen so that we can look at their answers? So our first question for the session is, what do you remember from our previous session? So we had 2 webinars already, but for the second webinar, what did you remember from our discussion with FIFA Rahman from Matahari? So we talked about the pandemic accord, but hopefully you can enter some insights or some key points that she raised during that session. So again, you can go to menti.com and enter the code 7603-6983. So we're still waiting for some responses from our colleagues. And if you're interested in listening to the webinar in French, you can click the More button at the bottom part of your screen, and then there's an option there where you can select interpretation so that you can go to the French channel. Okay, so some of you are first-timers, so it's fine if you don't remember, but later on, Jeff will be sharing the recording of that. The accord is under revision and discussion. Country groups who can negotiate. And again, PABs is one of the more contentious issues of the pandemic accord. We also see there are PABs in 3 exclamation points. So I think that's one of the key things, no? And of course, there's a need to include communities and civil society in these discussions. All right, so I think we can proceed to the next session, and I believe everyone can share their insights on this one, even if you're just attending for the first time. So what do you think? What are the key terms or key ideas that come into mind when you hear the concept of One Health and climate justice? No? So for some people, this might just be the first time that you're hearing the concept of One Health. So it's good because we have a very able set of speakers later who can talk about this more. So some insights are pandemic, interconnectivity, zoonotic diseases, everything is connected, right? So I think that can be expounded on more later. Mosquitoes, animal, human, and environment. Okay, I think we have we have audience who are quite familiar already, you know, with the concept of One Health, and of course, similar to what we've talked about earlier, there should be a conversation on the role of the community. And also one person said there should be a seamless interaction between climate health, both human and animal. So thank you for those insights. I think those words actually encapsulate what would be discussed, no, in the next few minutes. So now let's proceed to the next part of the program. Thank you so much for your active participation in our short activity. So now, just to introduce Copper, Knowledge Hub, and lessons, I'd like to invite Jeff Akaba, who is the APCASO Program Manager and also the ACT AP Coordinator. Over to you, Jeff.
Thank you so much, RJ, and it's nice to see everyone again. I'm very excited that this is the third lessons already, and we see some really high number of participants joining and are still joining as we speak. Again, welcome to the lessons of the Copper Knowledge Hub. Copper is the second phase of the Communities in Pandemic Preparedness and Response community engagement strategic initiative supported by the Global Fund. And as RJ already mentioned, this is in collaboration between ACT AP, hosted by APCASO, and also ACT Africa. And this particular lessons is being hosted also by the Learning Hubs, Prezode, and also CIRAD. So under the Copper project, we aim to do 3 things in 8 countries all across Africa and Asia Pacific. So we build knowledge and capacity of communities on pandemic preparedness and response. The second is we strengthen meaningful community engagement in terms of governance around pandemic preparedness and response. And also we support the coordination and evidence generation, again, surrounding pandemic preparedness and response. I already mentioned that we are working in 8 countries, and these countries include the Philippines, Indonesia, and Cambodia in Asia Pacific, and also Nigeria, Kenya, Liberia, Cameroon, and Sierra Leone in the African region. At the regional level, we of course have the Knowledge Hub, which aims to not only share information, but also learn from each other, not only through these different lessons or learning exchange sessions, but also through our different communications hub and different modalities as well, one of which is WhatsApp, wherein some of you are part of. The other modalities that we have includes the website, and I'm very happy to share with you that we also have the website, which is already operational. And on the website, you can visit the website at any time. It's copper.apcaso.org. You can watch the previous 2 lessons. It's already uploaded there. You can also read some webinar notes and also blogs related to the lessons. And also, and most importantly, we already have some of the materials that some of the country partners who have been implementing Copper at the country level have also shared through the website. So please do share, please do visit and also share and also utilize these different tools as much as you can as we continue to implement a more community inclusive pandemic preparedness and response. Lastly, I'd also like to take this opportunity that our MPACS guide is also finally out. So part of the responsibility and mandate of the Copper Knowledge Hub is to share information, as I mentioned earlier, on different issues related to pandemics. And because of the MPACS, we felt the need to have a community guide to support the work at the country level, not only within the 8 countries, but also beyond the 8 countries as well. So the community guide is already out. You can download it on the website. The link is down below, but it's very easy. When you visit the website, just go through the bottom part and you can download the guide. It includes basic information about MPACS, symptoms and complications, how it is transmitted, the prevention and management, and most importantly, the community engagement, especially in the area of human rights, and also gender as well. So please do download. And if you'd like translation of the MPACs, currently we have limited translation, but we will be able to translate them for you. Just reach out to us, to RJ, myself, and Rachel, so that we can translate that one for you. Currently, it's in English. The one on the website is in English as well. So please do download. With that, let's head on with our program today. And I'm very excited given that we have a long list of speakers for today. So back to you, RJ. Thanks.
Thank you, Jeff. I think that's very helpful for our participants, especially for the first timers who are just trying to navigate the lesson, right? We also have the recordings available in the Apcaso YouTube page. You can also view it in that platform. And of course, okay, so kindly, okay. There. So for every webinar, you can also get a certificate of participation. You just need to attend, participate in the discussion in the WhatsApp group after the webinar, and accomplish the evaluation form. So now let's proceed to the main part of our discussion. And we're very lucky because we have a very dynamic and knowledgeable set of speakers from our partner, Prezode. So we have three for today. So we have Marisa Perye, who is an epidemiologist and deputy director of the Animals Health Territories Risk Ecosystem, or ASTR, under CIRAD. We also have Dr. Flavie Goutard, who is our senior epidemiologist at CIRAD. And also later on, we'll have Jean-Hugues Caffin, who is the principal investigator for Senegal under CIRAD. So for this session, it's going to be quite different from our previous sessions, because here we'll have a general introduction first of Prezode, what they do, and then we'll have mini talks on One Health, climate justice, followed by a very short Q&A just to break the ice, and then we'll dive deeper into case studies in Southeast Asia, specifically Cambodia, and in Africa, specifically Senegal. And then after that, we'll have a longer question and answer session. All right. So without further ado, I'd like to turn it over to Marisa for her presentation. Over to you, Marisa.
Thank you very much. Good morning, good afternoon, good evening, everyone. So yes, I'm going to set the scene and maybe emphasize the needs for collaboration between animal environments and human health sectors and communities in this, to be able to prevent the emergence of zoonotic risk and fighting pandemic on the ground. Next slide, please. So as we know that 60% of all infectious diseases that are circulating in humans at the moment are of animal origin, and the ones that are still emerging, 75% comes from animals. And this has increased in terms of frequency and numbers over the past 50 years, closely linked to the impact of human on nature and climate change that brings increased contact between animal and humans and wildlife. Next slide, please. And we've seen it over the years, early 2000 with the SARS pandemic spread that started from wildlife in the markets in Asia. Then we've seen the H1N1 pandemics emerging from a pig farm in Mexico. And that was at the same time there was a lot of H5N1 avian influenza circulating as well, which is creating a risk. We've seen the Ebola spread in 2013 and 14. And as I mentioned, we still have the risk of the transmission between animals and humans of an avian influenza that could create a new pandemic. And of course, next slide, please. In 2019, we had the COVID pandemic that emerged probably from wildlife as well from Southeast Asia, and that has created more than 15 million deaths up till now. So next slide, please. From this, there is a consensus and a strong emphasis on the need to have an integrated approach to be able to prevent and not only prepare and respond, but also prevent those emergence. And that requires a One Health approach. What is a One Health approach is understanding that all the health are linked. So the activities we will have to reduce human issues might have an impact on the environment and on the animals and vice versa. So all these cells are interlinked and we need to take them into consideration. And we also need to work in a bottom-up approach. That means that to be able to prevent pandemics, we need to account for the people that are at the front line of risk, the communities, the actors that you represent. And we need to make sure that food security and livelihood of the poorest community are still ensured. Next slide, please. So as I mentioned, the communities are definitely at the forefront of pandemic prevention, and this is what we are really pushing strongly with PRESOD. And we will show you this little video on the rationale behind it. You can play the video, please. Thank you.
Oops. One moment.
So while we are waiting for the video to start, I can maybe explain a bit more, and we will see it a bit later what is PRESOD about. So PRESOD is a science-led initiative because as the scientist communities, we wanted to make sure that the action that would be undertaken to prevent emerging risk would be relevant and implemented at the local level. And this is and that the innovation supported by the research could also be heard at the international level and be embedded into policy. So this is an international coalition which is pushing this voice, the voice of the scientists, but also the voice of the communities and of the NGOs, the private sector, to ensure that the pandemic prevention is done in a bottom-up approach and in a One Health approach, working all together between sectors. If we can, maybe we can move on in the presentation and show the video later if there is some technical issues.
I think we can proceed first with the presentation.
Yes, okay,
Yeah,
and then or we can give you all a link to the videos and you can have more details on how this works. The presentation is gone. I can continue without the slides, but so just to gain some time, PRESOD scope. So what we are really working on is everything that is happening before the disease spread between humans. So we are working at the interface, looking at the spillover, the contact between animal and humans and wildlife and environment. And this is really where the communities are at the front line of risk, where there is this contact. They are the ones that are in contact with the animal production, the domestic animals, but also the wildlife. So we're working on strengthening this surveillance and preventing the risk of transmission between animal and human at this interface. But we're also working, trying to understand how the pathogens are being spread between animals and in the environment. So looking at all this pre-emergence stage. And the way that PRESOD is implementing activities as well to promote this change in paradigm towards prevention in a bottom-up approach. So we have built, as a co-design approach at the international level, a scientific framework with more than 1,500 participants from all over the world during 27 international workshops. And we've built this framework, which is based on 5 pillars. The first pillar is about understanding the risk of zoonotic spread and the risk practices. So what are the activities that communities and humans are implementing at the local but also national level, which is pushing those risks. The pillar 2 is about co-designing solutions to reduce the risk. So working with the people, the community as the front line of risk to be able to to find solutions to reduce the risk or change practices, have alternatives that are not impacting their livelihood. The pillar 3 is about this interface surveillance to be able to early detect and have early warning system when there is a animal disease that spread to humans, and be able to co-design this system as well, because the people that are at the front line of risk are the ones that can detect early and prevent and stop the spread of animal diseases before they become a human issue. The pillar 4, which is about sharing all this knowledge at the national but also international level, so country can better prepare. And we have a cross-cutting pillar, which is the foundation pillar, which is about engaging of all those stakeholders in the co-design approach. So meaning that all the solution needs to be built by and for the people that will implement them. And a lot of them are the community, but also in consultation with the authorities, because they are the ones designing the policies. And if we want this to be sustainable and integrated into national policy, they also need to be involved. So the main aims of PRESOD have 3 also global aims. One is to build a common scientific framework to be able to implement and coordinate research, but also development projects in the field to maximize their impact, making sure that they are implementing following best practices and best values to address all these issues I've mentioned, but also creating a data platform for data sharing, and becoming a resource center for decision makers to make sure that the policy are based on evidence from the field. So at the moment, PRESOD is an international coalition with more than 250 members, which are coming from different types. We've got NGOs, we've got civil society organization, we have private actors, we have representative of governments, and this panel of people represents more than 80 countries worldwide. And what we are also doing is we engage countries at the political level. So we have 27 countries engaged politically, which allow us to talk at the same time at the ministry level and at the local level, and to ensure that everything that is being developed and relevant for pandemic prevention, preparedness and response can be embedded into policy and adopted as well by the country. We also have operational activities to be able to support this. And at the moment, we have activities in 15 countries in the world, in Africa, Asia, and in the Caribbean. And you will have more information on the activities that are being implemented, especially in Cambodia and Senegal, with the presentation of my colleagues Flavie and Jean-Hugues after me. So that is it for me. So there is 2 videos that you'll be able to have a look at, one on the community-based surveillance and what is PRESOD all about. So I'll encourage you to have a look later on. But what we could do now, or maybe after all the presentation, is also discuss on how you could engage as a representative of the communities, how we can work closer with you to be able to push this change of paradigm towards prevention in a bottom-up approach. Thank you very much.
Thank you, Marisa. It seems that in One Health, we should also include digital as one of the sectors, because sometimes technology is not on our side. But I think we're able to play the video now. Is it fine? It's just 2 minutes each.
Okay, sure.
Yeah.
Thank you so much.
Thank you.
PRESOD is an international collaborative initiative that aims to enhance the prevention, early detection, and resilience to rapidly respond to emerging infectious diseases of animal origin that can turn into pandemics. PRESOD strives for broad international coordination and has already brought together a global multi-actor community of more than 230 members, including research institutes, academics, NGOs, and 25 governments. Prevention is the most cost-effective way to avoid pandemics. Its effectiveness is ensured through science-society policy dialogues, bottom-up approaches, and collaborative surveillance with people at the front line of risk. By being the closest to the living scene, Local communities are playing a major role in detecting and reporting unusual sanitary events as soon as they occur. PREZODE is based on the One Health concept, which integrates human, animal, and ecosystem health. In 2023, we launched 10 in-country projects in the Global South and an open call for projects in Europe for a total engagement of 60 million euros. We have also built on our members' existing operational projects and expertise and set up an operational governance of the initiative. With the Paris Peace Forum Scale-Up programme, the number of PREZODE members multiplied by 1.5 in 1 year. We engaged with new international stakeholders to strengthen our actions. We enhanced our collaboration with international health organizations through current or in-progress high-level working groups. Our visibility and positioning as an international scientific framework for pandemic prevention were increased, with references to PREZODE in various high political platforms.
So now let's go to the other video.
Yes, and as you might have seen, since we have made the video, we have increased our number of members and countries. So it's still happening, which is great because the more we are, the stronger voice we have.
All right, so this is about the community surveillance system.
This morning, Yep, a poultry farmer in Bacnin, found dead hens in her yard. The others look sick too. Niambo, a forestry worker in Lesterville, feels feverish since he went into the forest to check on sick monkeys. Sophia is shocked when she discovers her sheep's dying next to the little river close to her farm. Community members are the first to be affected by any health event. They are the starting point and major actors of the health surveillance chain. They report their issues to the local specialists, who refer to their supervisors to get the laboratory team to investigate and seek for the cause of the disease and alert higher authorities. We often think of surveillance as experts looking actively for viruses. This is indeed important, but not sufficient. It doesn't allow the fast detection of the first signs of zoonosis, a disease transmitted from animals to human that can turn into a pandemic. With the community surveillance, we can detect fast enough alarming situations and implement useful actions. That's why their members have to be considered as part of the surveillance chain. They also need to engage back in reporting and responding fast to contain any health event as soon as they face it. We need to support their engagement by listening to their needs and constraints and create a win-win partnership. With the technology and research available today, it's possible to provide community members the information they need and get them to report in real time the events they are facing. Effective prevention of diseases and contamination requires sharing of information in real time at all levels amongst all actors, including the community. This is in line with the One Health approach, which calls for collaboration across human, animal, and environmental health. The community members are an essential part of it. Support science-based solutions with the PREZODE initiative.
Okay. Thank you, Marisa, for that presentation. I think it was a good introduction for all of us, especially for those who are just being acquainted with the concept of One Health and climate justice. All right. So now, are there any questions from the participants? Probably we can take on one or two. Okay, so we have this question from Indonesia. So would you want to ask the question directly? You can just unmute and then you can ask your question.
Yeah.
Go ahead, please.
Okay, thank you, Archie. Thank you, Marisa. My name is Anon from Indonesia. As I mentioned before that I see the presentation and Indonesia is not part of the list, so I'm interested how to contribute in the trade zone because the topic of the One Health as well as the zoonotic disease research in Indonesia is still emerging. So maybe we can contribute to the global level. Thank you.
Yes, absolutely. So there is some technical partners from Indonesia that are involved, but Indonesia as a country is not a member yet, and that would be very interesting. So you can get in touch with Flavie, who's here today, who's the regional focal point for PRESOD in the region, and or with me, of course, and we can discuss this further. So to become a member as an institution, it's very simple. We wanted to make it very simple that you only sign a letter of intent which specify the value that PRESOD wants to promote. It's not engaging nor financially, nor contractually, nor legally. But it's really showing that you agree with the principles and the values. And it is the same at the country level. So, and there is a need really to engage with countries like Indonesia, which are key in One Health and key in this emerging risk prevention, because you've been doing a lot of activities for a long time. So, yes.
All right. Thank you for that question and as well as your response, Marisa. I think the key here is collaboration, and later on we can facilitate discussions with Flavie for those who are also interested to join the network. Probably we could take on one more question before we proceed to the case study so that we could have a longer discussion later. So Rachel is asking, are national entities on climate and environmental protection agency part of the PPR national stakeholders? Can they be an important entity to support PPR?
Yes, absolutely, and Flavie will emphasize on that on our presentation, because the different sectors are key, and their representation are key. Environment is an important sector. There is a lot of impact on human action on the environment, which have consequences for health, animal, but also environmental health and human health. So, and there is not enough environmental actors engaged in this field yet. So definitely they are key actors.
Right. Thank you. And Karine also placed here the contact details of Flavie. But since we want to also know more about what is happening on the ground, I'd like to introduce also Flavie, Dr. Flavie Goutard, who will be sharing the case of Cambodia. And then it will be followed by the inputs from Jean-Hugues Caffin from Senegal. So over to you, Flavie, and then later on, Jean.
Thank you very much. Let me share my screen. Okay, so do you all see my screen? It's okay?
Yeah, all good.
So I will present you, so following the presentation of Marisa, of one activities that we are implementing in Cambodia under the PREACT programs and the project Africam, and another EU project named Becoming, and where I will show you very briefly what we do to set up a One Health community-based surveillance network in one of the northern provinces in Cambodia. So first, just to set the scene of what's happening in Cambodia and at community level. So in rural areas, there is many ways for people to be in contact with infectious diseases. So when you are taking care of the animals, livestock, when you have dogs around and can be and you can be bitten by a dog, or when you are consuming the meat or the milk produced by your animal, but as well through hair with you have some diseases that are transmitted and airborne diseases. So there is at community level a lot of ways that you can be infected by these zoonotic diseases. And in Cambodia, there is specific issue. So in rural communities, you have a high zoonotic disease risk, especially for some diseases like avian influenza, or known as bird flu, which is in fact transmitted first. So you have the viruses in wild birds that transmit the viruses to the poultry, to the poultry. It can be chicken or ducks, and then transmitted to human. You have other diseases like rabies that can be transmitted by dog bites, or Japanese encephalitis, which is a virus transmitted by a mosquito that you find in pigs. And where you are raising pigs around your village, the mosquito can transmit the disease from the pig to you by mosquito bite. And in Cambodia, so you have all this risk of infectious diseases, and on the other hand, you have a surveillance systems that are existing in different sectors, but are very fragmented. There is still not enough coordination between the wildlife sector, the public health sector, and the livestock sector, and there is delay. When you have an outbreak in one sector, you have delay of sharing the information, which can increase the risk for the communities. And on top of that, in some province, in some very remote area in Cambodia, you have some poverty or dependence on agriculture that can increase the risk and limit the capacity for recovery of the rural communities. So in order to solve these issues, there is some action that need to be taken. So like raising awareness and promoting safer practices, integrating more local knowledge into the construction, the building of early warning systems, and to improve this system and contribute to some more resilient strategies. And it's what we try to do in Cambodia. So surveillance or community-based surveillance, and One Health community-based surveillance. The idea is to include all the sectors as early as possible in the monitoring of diseases and on the early warning of any event that can happen in the different sectors. So engaging the sector of environment with the wild animals, the sector of agriculture and livestock, and the sector of health, and looking at these three sectors and engaging them in the community-based surveillance. So the idea to develop this One Health community-based surveillance is to strengthen the partnership between different local communities and local actors like wildlife rangers, community health workers, civil society organizations, communal veterinarians, and so on. It's not, I mean, there is other type of actors. And to link these sectors, the wildlife, the human and the animal sectors, with as well an active community involvement in order to detect the outbreaks as early as possible and to provide community-driven intervention. So what we have done in Cambodia, we started to work with WCS, which is an international organization on wildlife conservancy society. They have wildlife surveillance system, and we are working with them and with the Cambodian government to improve the systems which is already existing and to make it more One Health and more community-based. So in Stung Trend, in one of the provinces, what we already did, it's we look at how at province level the risk, the disease risk is understood, what is happening, the prioritization of the risk by the communities themselves, the actors, so a mapping of all the different stakeholders, as well to do a situation and need analysis of the local system, describing this system and describing the capacity of the system to detect an unusual event, and as well within the system, who is talking to what, because we know that at community level, there is information sharing between sectors, between wildlife, agriculture and health, but sometimes it's not health information, it can be on production or other events, but there is this system. So the idea was to understand how people interact with each other, to then on the next step to develop some relevant surveillance systems that are based on what's happening in the ground and that are as well more acceptable and emphasize collaboration. So it's what we did. We had different interview, we had focus group discussion, we had more than 12 focus group discussion, engaging more than 130 community members. And at every focus group discussion, we asked them to describe with us how the communication, what are the type of information they are sharing with whom, what are the barriers of the communication, what could be improved, how this could be improved, and so. So here are some pictures of what we draw with the community member, and this is a representation of, for example, the information that which is shared within the wildlife sectors. So you see there is a lot of actors, a lot of type of information. So it's what we are now. The next step will be based on what now we know and how it's effectively done at community level to develop a community-based early warning system, to co-create that with the community involved, to have the system which is more responding to their need. To test these pilot sites with, of course, the community engagement, to evaluate this pilot surveillance system, and then with the evaluation, then to propose at national level to integrate this pilot at a more upscaling level. And that's it for my example for Cambodia. I will stop sharing.
Thank you, Dr. Goutard. And in her presentation, she emphasized the role of communities in terms of raising awareness, integrating local knowledge, and also contributing to build resilient strategies. And she also showed us a very clear, I know when you implemented it, it's quite messy and difficult to like put it, but you presented it in a very nice format, and it's also very easy to digest. And I think it will help our participants develop their own community-based surveillance systems, and then later on also hopefully integrate it into their national health systems. Thank you. So I know we've been receiving some of the questions here, but I'll be reserving the Q&A after the presentation of our next speaker. So for our next speaker, he will talk about the case in Senegal. So over to you, Jean. Yeah, Jean, I think you're on mute.
Sorry.
And
Oui, bonjour. Donc, je suis au Sénégal et je vais parler en français. If it's okay for you. Vous m'entendez?
Yes.
Est-ce que vous m'entendez?
Oui.
Bien, donc je vais parler effectivement d'expériences que on réalise dans le cadre de Préact également. Donc, il y a des programmes opérationnels similaires à celui qui est mis en place au Cambodge et présenté par Flavie. Alors, tout d'abord, je voudrais redonner un petit peu un éclairage sur ce qui a déjà été fait au Sénégal. Donc, la difficulté sur les programmes existants qui a été identifiée, c'est que l'engagement sur les zoonoses, c'est parfois une priorité qui est, si elle existe, qui n'est pas la principale des communautés. Et donc, pour eux, ça peut être quelque chose de distant. Et du coup, le process, souvent, c'est d'abord de construire un dispositif à la base qui sont plus centrés sur les priorités des acteurs. Ensuite, intégrer sur ce système un dialogue sur la sensibilisation aux zoonoses pour montrer que aussi, en fait, même si elle n'est pas visible, elle joue un rôle important et c'est un risque important pour eux. Et après, étendre le dispositif de surveillance existant aux enjeux zoonotiques. Alors, cette approche, elle a été mise en place par un programme pendant une dizaine d'années au Sénégal qui s'appelle l'Info Santé dans 2 régions pilotes. Alors au départ, on a eu un dispositif de surveillance communautaire qui était centré sur, alors c'était sur la santé maternelle et infantile. On était à l'époque plutôt des objectifs millénaires sur le développement, donc on avait vraiment des indicateurs sur ces éléments. Et donc là, on suivait des points très spécifiques sur ces régions, sur des problèmes de grossesse à risque ou des risques sur voilà, sur la maladie infantile. Et donc, c'était un programme qui avait été développé par l'UNICEF et où il y avait eu, au niveau communautaire, des premiers dispositifs avec des conseils au niveau des communes et un outil de suivi avec des systèmes de téléphonie mobile et qui pouvaient à la fois faire remonter de l'information et pousser des informations en termes de prévention. Et donc, ce dispositif, quand il a été utilisé ensuite par un autre projet qui s'appelait Measure Evaluation et qui s'est emparé du système et puis a essayé de le renforcer et de l'étendre à la surveillance zoonotique. Donc, il y avait les comités de veille et d'alerte qui avaient été faits au niveau des communes, dans lesquels on a essayé d'intégrer les enjeux de surveillance zoonotique, qui sont devenus des comités de veille et d'alerte sanitaire intégrés, en essayant d'intégrer à la fois les éleveurs et les agents communautaires en santé animale. Et puis, la plateforme informatique, qui a aussi été utilisée pour pouvoir faire remonter l'information sur ces enjeux. Alors, ces projets, ils ont aussi été soutenus par des animateurs qui étaient financés par le projet au niveau des départements et qui ont permis sa mise en œuvre, le renforcement effectivement de tout ce qui a été formation et la modération aussi des dispositifs d'échange d'informations. Alors, c'est un système qui a, qui a beaucoup fonctionné pendant l'épidémie de Covid au Sénégal. Ces comités de veille et d'alerte se sont un peu diffusés à d'autres départements et ont vraiment permis de renforcer la surveillance communautaire pendant la crise du Covid. Après, on a vu qu'après le Covid et après la fin du projet, ces activités se sont arrêtées. Donc les comités existaient toujours, mais on n'arrivait pas vraiment à les faire vivre. Et du coup, il y a eu une étude qui a été faite par l'Institut Pasteur pour essayer de comprendre pourquoi ça n'avait pas continué à l'issue du soutien par les projets et suite à la pandémie. Les éléments mis en avant, c'était que il y avait dans ces comités un noyau dur qui le faisait vivre, qui sont les Badjenogor, c'est un acteur dans la communauté sénégalaise, qui veut un peu dire les grandes sœurs et qui s'occupait beaucoup de santé maternelle et infantile, et les agents de santé communautaire. Et donc, eux, ont été un petit peu réaspirés par des urgences du quotidien et ils ont pu, en l'absence de ce dispositif et d'animation, ils ont arrêté de faire le rôle qu'ils faisaient en matière d'animation des comités sur la surveillance. Et puis après, il y avait dans ces comités un espace plus périphérique avec des chefs de village, des chefs religieux et qui, en fait, se sont mobilisés pendant la pandémie, mais ensuite se sont pas sentis vraiment appartenir à ces comités de veille, sauf en cas d'urgence. Et le troisième point, c'est que sur les zoonoses, il y a un rôle prépondérant qui doit être joué par la communauté, et notamment les acteurs communautaires en santé animale. Et ça, et bon, il y a un certain nombre de papiers, de recherches qui montrent il y a peu d'acteurs, il y a un faible maillage territorial sur les acteurs communautaires en santé animale par rapport, par rapport à la santé humaine. Donc, alors, il y avait un premier questionnement qui est lié dans cette étude, hein, qui était de l'Institut Pasteur, où eux, ils ont des sites précis sur lesquels ils voudraient avoir de surveillance sentinelle et sur lequel ils souhaiteraient pouvoir avoir des éléments des acteurs communautaires en santé humaine et en santé animale. Et donc là, se posait la question à la fin du séminaire, hein, une des recommandations, c'était de les financer directement, puisque si comme ça, de façon ciblée, ça apparaissait pas comme une de leurs priorités, mais que c'était utile pour l'ensemble de la communauté, des populations des villes et des populations du Nord, ça pouvait faire sens de financer directement ces relais. Alors nous, qu'est-ce qu'on fait ensuite dans le cadre du projet Africam et PREAC? Donc on travaille dans la région de Kédougou, qui est une région à la frontière avec le Mali et le Sénégal, où il y a aussi un grand parc naturel, avec beaucoup d'enjeux entre la faune sauvage et puis les animaux d'élevage. Donc on a accompagné le recrutement et la formation d'auxiliaires communautaires en santé animale. Hein, donc on a pris cette porte d'entrée. L'idée, c'est alors les bonnes pratiques qu'on a pu identifier, c'est de construire et mettre en place l'activité avec les services d'élevage déconcentrés et les chefs de village. Parce qu'au début, il y a eu notamment des questionnements, notamment des services déconcentrés de l'élevage, hein, sur comment ça allait s'interconnecter avec eux. Donc, de le faire vraiment pour qu'ils agissent sous leur autorité. Et notamment parce que le fait d'agir sous leur autorité leur permet aussi de les former sur ces enjeux zoonotiques et de détection précoce, parce que sinon, ils peuvent avoir, comme ils sont financés par leurs prestations, avoir tendance à se focaliser sur le curatif. Donc, ça permet aussi de bien les intégrer dans le système de surveillance. Et après, de favoriser aussi le recrutement comme auxiliaires communautaires d'éleveurs qui sont déjà dans leur communauté, hein, ce qui leur permet à la fois d'avoir une influence et puis de rester, parce on voit qu'il y a eu beaucoup de cas quand on est arrivé où il y a eu des programmes pour former des auxiliaires communautaires en santé animale. Il y a même une formation nationale au Sénégal, mais qui ensuite sont, quand on les forme au niveau local, qui s'en vont, hein, sur d'autres opportunités. Donc voilà, pour assurer la pérennité. Donc ça, c'est ce qu'on a commencé à mettre en place. Et ensuite, pour essayer de faire le lien avec la santé humaine, on favorise l'intégration de ce réseau d'auxiliaires communautaires en santé animale dans d'autres dispositifs qui répondent, qui ont été créés avec les communautés plus sur des questions de One Health, mais qui répondaient aux enjeux spécifiques des communautés. Donc, notamment dans cette région où il y avait beaucoup de culture du coton, il y a eu un certain nombre de comités qui se sont créés autour des enjeux agricoles, hein, avec les enjeux d'intrants, les enjeux de pesticides, les enjeux de qualité de l'eau. Aussi des premiers, tout un travail qui avait déjà été fait sur la résistance antimicrobienne. Et du coup, l'idée, ça a été d'intégrer et les enjeux sur la surveillance zoonotique et le dispositif de surveillance communautaire en santé animale dans ces comités One Health déjà existants. Et puis après, on a aussi on essaye aussi de mettre en avant des études et enquêtes dans des projets où on a des plateformes d'échange à la base qui montrent dans certaines zones des priorités accordées aux enjeux zoonotiques. Hein, souvent, ça peut être assez localisé ou à certaines populations ou à certaines zones. Et voilà, et donc ma conclusion, c'était de souligner l'importance d'intégrer ces enjeux des différents acteurs à la base. Hein. Là, je parle beaucoup des auxiliaires en santé vétérinaire et puis des dispositifs en santé humaine, mais il y a aussi le besoin d'intégrer effectivement tout ce qui est les éco-gardes, les acteurs communautaires qui travaillent dans les parcs, qui sont parfois en tension avec les éleveurs, et du coup, il faut arriver à les associer pour co-construire ensemble les activités dès la conception des projets. Voilà, je vous remercie.
Thank you, John. And from his discussion, I think what we can appreciate from that is the importance of doing evaluation, no, as a means of improving our programs. And we also understood from his presentation that when we talk about the human, animal, and the environment, we have to look at them as systems, no, that interact with each other. And the challenges that we face in these systems are not isolated from each other. That's why when we develop interventions, they have to be integrated with each other. And when we develop these interventions, they shouldn't just be centralized to one agency, but we also have to bring the community with us, especially those who are working in the grassroots. And of course, he also mentioned the challenges of sustaining civil society participation even after COVID. So I think that was a very comprehensive presentation, both from Flavie and John. So now, I think for the next part of our discussion, we'll be opening the floor for questions to our participants. So you can either ask away by unmuting, but hopefully you can raise your hand first in the chat so that I can acknowledge you, or you can also put your questions in the chat. And looking at the chat right now, it seems that a lot of people are interested with your presentations with so many questions while you were discussing. So there was this question coming from Joseph. And he was mentioning that the concept of One Health precedes that of pandemic preparedness and response. So does the PPR fill its limits, or is it an extension of One Health? So anyone can probably answer. I think Marisa can also answer if she's still here in the call. Yeah. Thank you for turning on your camera.
Yes, the One Health concept is quite old. It's so we haven't shown the full history, but and I would say even older than we think, because people in the community, they collaborate, they work together, and indigenous people, they are working in harmony with or they're living in harmony with nature, which is about that. It's about living in harmony with the different sectors. So it's more a way of working and a way of thinking than a specific activity per se. Having said that, so then the prevention of emerging risks, which are linking this, directly linking us to animals and environment, has to fit into this One Health approach. And the way we work towards infectious disease and emerging risk needs to take this way of working and way of thinking to be able that we take into consideration what our impact on nature that are reversing back to nature as getting to pathogens that are in nature getting back to us. I hope I have answered the question.
Thank you, Marisa. So basically, One Health is also a very old concept that it might be interesting for us to also track how it developed. Jean or Flavie, would you want to add to that? It's fine. We can proceed to the next question if ever. So one question here says, how can One Health manage the cases of indigenous people's rights when there are lands and resources that are taken from them on the grounds of national development? So I think this extends beyond the One Health approach and somehow delves into the more political and structural side of things. But I think it's a good question also. Go ahead, Flavie.
Yes, it's a bit beyond, but what I can say that within One Health approach, there is, in fact, there is methodology. I mean, the idea is to be inclusive once you apply this methodology, and to have inclusive decision making as well. So with the bottom-up approach, I mean, at top-down and bottom-up approach to have an inclusive decision making, and to integrate the different sector, but as well to take into consideration the traditional knowledge by assessing social, cultural, economical implications. So it's not only the sectors that need to be integrative; it's all these different directions that need as well to be included within the One Health. Yes, One Health is not only sectorial. It's as well to have a transversal approach, a bottom-up and top-down approach to join both and to take into consideration this cultural, social, and economic aspect as well. I don't know if I answer the question, but
Thanks, Flavie. And I think the legal aspect also should be like considered as one of the things to think about. Anyone who would like to add to that? Since Flavie mentioned something about local knowledge, and Lance here is asking, how can we ensure that communities who share their local knowledge also have equitable access to the benefits arising from the use of their knowledge? So for example, if we're talking about medical products, vaccines, medicines developed based on data shared. So somehow this is like a throwback to our previous discussion on the pandemic accord and the issue of PABs. But yeah, maybe we can also like apply it in the concept of One Health and climate justice.
I could add a little bit, but in fact, as I said, I mean, when you apply the One Health, when you look at, I mean, there is already, I mean, you need to think about some type of agreement or framework where you have fair compensation. I'm thinking about in health and in environment and wildlife, we have this Nagoya Protocol, where in fact it's ensuring fair compensation and equitable distribution of benefit. Nagoya, it's when you have samples from wildlife to be sure that this stays the properties of the country where the samples have been taken from wildlife. So you need to think of that. So it's why you were talking about legally. So we need to have this agreement set up. And in One Health, there is a lot of people thinking of that or looking at that. Of course, when you are working with community, you need to have a free, prior, and informed consent at community levels. That is very important to be sure that their contribution is not after there is no usage of this information that are sharing with us. Yes, there is some different mechanisms at One Health that are proposed to help with this issue, which are not perfect, I agree, but it's taking into consideration.
Thank you, Flavie. I think.
Yes, can I add something?
Yeah, go ahead, Jean.
Oui, je voulais dire que l'initiative Présode, elle est aussi là pour influer et proposer une certaine vision du One Health. Donc, par exemple, l'initiative participe aux négociations sur le Pandemic Agreement et permet de faire remonter aussi un certain nombre de voix de chercheurs et d'institutions de recherche des pays membres, et notamment des pays émergents et des pays en développement, pour qu'ils puissent avoir plus de voix dans les négociations. On le voit aussi au niveau national, on peut avoir des approches très top-down qui sont poussées, et notre rôle, c'est aussi d'aider, d'accompagner par la recherche à faire des fois un pas de côté et à essayer de promouvoir des approches plus inclusives, que ce soit au niveau national ou au niveau local. Donc c'est aussi quelque part, il y a quand même des jeux d'influence et on essaye, en tant que présote, de participer d'une façon plus, pour promouvoir une logique One Health qui soit plus systémique et plus inclusive des communautés.
Thank you, Jean. And I think we also need to discuss about climate change and climate justice and pandemic. So I think Flavie also prepared a session on that. Can we proceed with that first and then go to the Q&A afterwards?
Okay. Yes, I will share my short presentation. Okay. Okay. Yes, trying to set the scene on the impact of climate crisis on pandemic, which sometimes it's not always very clear. So in fact, the climate change will provoke extreme weather with precipitation, heat, storm, floods, and this will have some direct effect on the exposition of the population, and so on their health, on the physical health issue, but as well this impact of climate crisis and climate change will have some indirect effect through the environment where we are setting. Through our condition of life, but through the animal condition of life and the environment where these animals are living. So in fact, there is direct effect, indirect effect, and then this climate crisis will as well have an impact on the social and economic livelihood of the people. So in fact, you have a direct effect that is kind of easy to understand, but indirect effect as well from this climate crisis. And if we look at how that can be impacting, and mainly the most vulnerable population and as well country with the most fragile health system, this population and this country are already the most exposed to climate-related health threats. And when you have disasters that are induced by climate, so flood, droughts, as I mentioned, change in precipitation, rising of temperature, this will have an impact on the healthcare system and infrastructure, which will make even more harder in case of a pandemic or an epidemic at country level. So this climate change will have an effect on the land. So with drought, flooding, it will change the way people can use their land for farming, for agriculture. So we will have an ecosystem disruption. So people will have to change their way of farming, and so it will change their the livelihood they gain from agricultural sectors. And as well, another impact is that this change of climate, so for example, change of precipitation or rising temperature will have an impact on the condition of insects like vectors. So these vectors will move from one region to another region, they will spread. And so the diseases that are transmitted by this vector will as well spread. And this is linked to climate change. And for other type of disease as well, with movement of wild animals, for example, where you have a change in the environment, in the deforestation because of climate change, you will have a change of how these wild animals are spread, and you will increase contact with human population and increase the risk of disease transmitted through wild animals to human. So this climate change have an impact on land use, on agricultural livelihoods, can increase disease transmission through animals, wildlife animals, and vectors. And at the same time, the climate change will have stress at family level and will certainly make individuals more vulnerable to this impact. So it's a vicious circle. So to address that, there is a need to address the climate change effect at the same time as the pandemic or the future pandemic effect, and to apply equity in addressing these issues. So equitable access to resource. So we need for vulnerable communities an equitable access to vaccine, healthcare, but not only human vaccine or human healthcare, as well access to animal vaccine, to have a husbandry system adapted, to have access to clean water, nutritious food and energy for human, but for animal as well, and to target an investment to strengthen this health system, and not only medical health system, but as well the health system of animals. So there is as well a need to advocate some fair climate adaptation funding. So this equitable funding is necessary to have a better adaptation and to have a more public health resilience. And it should prioritize vulnerable population, to invest in infrastructure, healthcare, and education, to prepare for future climate shocks and pandemic, but again, without forgetting in this prioritization other sectors than the human health sectors. And of course, we need to link this climate action with health equity with the implementation of more inclusive policy, and to have that in regions that are the most affected by the climate impact. So as I mentioned already, we shouldn't apply that only in one sector. There is a need for adaptation to look across sectors, so to have a One Health approach. And as I mentioned, global warming will have an impact on the transmission of infectious disease, will have an impact directly on the human health, but as well on the animal and the environment health by losing biodiversity, having an environment which is deteriorated, so degraded, where you have deforestation and so. So there is a need to address that through a One Health approach. So to have collaboration between the sectors, between public health, environmental protection, agriculture. And this collaboration is key to create a resilient health system and to address some shared risk. Because if we have impact, if the climate change will impact our environment, it will impact our food security, our water safety, and as well, as I mentioned, the increased risk for zoonotic diseases. So integrating climate change mitigation within the public health strategy is necessary. And for that, there is, again, a need to involve local communities, health systems, and government to anticipate and to address this impact of climate-driven zoonoses, to strengthen disease surveillance in high-risk areas where you have deforestation, land use change, extreme weather events, where all these events will increase human-animal contact and then increase the risk of disease emergence or disease spread between the different compartments. And so it's why we are really inside PRESOD and in the different programs within PRESOD, on first side, the importance of early warning system and the importance of setting up One Health framework to be able to prevent that and not, yes, to strengthen the prevention and not the reaction to that. And my last slide was just to show a little bit ahead what's, in fact, it's what we are doing in PREACT. So it was mentioned by Marisa, and we mentioned it with Jean-Hugues and my presentation for Cambodia and Senegal. What we presented is done under PREACT, which is an operational program of PRESOD. And under PREACT, the objective is to propose prevention solution adapted to local context through a One Health approach. And so it's not only surveillance, it was the two examples that we gave with Jean-Hugues, but it's as well other implications. So the objective under this program is to strengthen knowledge of emerging zoonotic diseases. It's to identify and monitor the risk through a bottom-up approach. It to strengthen the risk management capacity at territory level, and to as well strengthen the efficacy of local organization. And inside this program, there is different components to address this objective. So one which is assessing the risk, one about the reduction, one about the implementation of monitoring system, and there is a transversal component where there is as well a lot of effort put to develop gender and climate-oriented solution and to strengthen the dialogue with researchers, civil society and policy. And it's a little bit what we are doing here today. I'm a researcher, and the idea of this webinar is a little bit that. Thank you. And I think it's my last slide. Yes.
Thank you, Flavie. And I think some people are interested in knowing more about the study that you mentioned. So hopefully we can have further conversations later in the WhatsApp group. But I think based from our presentations today, we saw that we were introduced to the concept of One Health at the start of the discussion. And now Flavie gives us another issue to think about, which is the intersection of health and climate change, which can also worsen the inequities that people face. And this requires a lot of proactiveness on the part of civil society as well as governments to ensure that resources are equitably distributed. There is adequate funding for climate adaptation measures. And also we develop interventions to address the intersections between climate action and also health equity. So now we proceed to, now we have a more holistic understanding about the topic. We proceed to the Q&A. We've left some questions in the chat. There was one question talking about how integration is actually done while avoiding parallelism or punctually integrated action. So they say that the reality is that project financing is usually done in silos and does not always benefit other related sectors. So it is the person said it's therefore important that funding goes to the most decentralized level. So can we have your reaction to that? How do we face the realities of project funding as it is? Yeah, anyone can jump in?
I could try. I mean, so it's an issue, and in a lot of countries I work, it's a reality. Within the development of some project, we from the very beginning we have, so in some country you have this One Health platform or forum that are already existing, which depending on the country is efficient or less efficient or very new. But the idea is to first get engaged with, when there is a platform already existing that engage different ministry or the different sector at the same level. I'm taking the example of Vietnam, where we have a One Health partnership, which is kind of strong, which is really covering the 3 sectors. And in fact, any intervention or discussion that we had was going through this One Health partnership to be sure that at the very beginning, any implementation is discussed across the sectors, and that is, yes, we look at an integration from the very beginning. And then, of course, the other issue is to have that to go down to follow that at more decentralized level, which sometimes it's more complicated. It's in fact, it's, for example, in PRESAD, it's what we try. In Vietnam, we have that at national level, it's very strong. And one of the things that we are discussing is to have it more operational. So to have this principle of One Health, which is really implemented along the chain of command, from bottom up, but it's why I like, I mean, we need to emphasize the bottom up approach, but we need as well to work at top down or at national level, that in fact it's supported by the national direction or vision. In Vietnam, it's very important, this type of approach, so we cannot work. And yes, so this is one thing that we try to do, but Marisa, you can...
Go ahead, Marisa.
Yes, no, I just wanted also to say that this is one of the objectives of PRESAD as well, is to have a strong voice to influence the donors so that they actually change the way they fund this project. And it's a real issue because donors are organized in silos, international organizations are organized in silo. So this is one thing we are trying to push, and there is some donors that are evolving, such as, but there is a pandemic fund from the which is supported by the World Bank, which is really funding a One Health approach. There is no silo, and the Global Fund is evolving also in the way it is funding PPR, because it's embracing this One Health approach. So yes, so we can also have this voice at this level to be able to make changes, so more funds can go to integrated approach and at the local level as well.
So it seems that it's really a big concern in terms of like the siloed funding. But Flavie said that there are starting points that we can engage as members of civil society. We have to look at if there's an existing One Health platform in your country, you might be interested to engage that. But it also highlights the work of PRESOD in terms of influencing the funders to making sure that the funding is not done in silos. Jean, you want to add? Go ahead.
Yes, oui, je voulais ajouter l'importance aussi d'avoir une appropriation nationale sur la stratégie et les objectifs One Health qui soient vraiment intégrés. Parce que même si on a après des financements qui peuvent prendre en compte le One Health, si on n'a pas travaillé sur des priorités, par exemple, moi, en participant aux ateliers sur le Pandemic Fund, on a des acteurs sectoriels qui viennent avec leurs revendications et qui finalement sont en tension pour essayer de faire passer leur activité sectorielle. Donc si on n'a pas pensé avant à une question de dialogue politique, pour ça que c'est un des objectifs de PRESOD, pour essayer de définir des objectifs communs ensemble, après on se retrouve en concurrence. Et du coup, on a un sujet, une plateforme nationale qui va arbitrer, mais où on n'a pas co-construit ensemble une vision. Et c'est vrai au niveau national. Et alors, moi, au Sénégal, c'est moins vrai au niveau territorial. C'est-à-dire que si on a des plateformes de discussion, on a des enjeux territoriaux qui vont peut-être plus facilement faire consensus. Hein, on arrive à trouver des priorités du territoire. Et on est moins en tension qu'au niveau national. Donc, pour moi, il y a vraiment un enjeu national à construire une doctrine nationale sur quelle priorité, quelle approche et quelle priorité on veut mettre dans le One Health.
Thank you, Jean, for emphasizing the importance of having a shared vision in terms of how do we actually implement One Health so that it doesn't it's not fragmented. And you also highlighted the importance of constant communication of different agencies. Now, there's this question from Paul. He says that caring for animal health as to human health in Africa is a huge problem, and our government struggles a lot in their health system strengthening. Are there mechanisms to support countries, and what could be the role of CSOs and communities? So maybe you can share some more insights on how to also address animal health that CSOs and communities can do to support their countries.
I'm not sure if I have understood the question properly. I don't know if it's animal health in general, or I mean animal health at production level, for example, in livestock sector. Is it health or I'm not sure about the question. I mean, I'm not sure how to answer this question.
I think Paul is asking if what can CSOs and communities do to support animal health, which can also contribute to health system strengthening. I think someone can elaborate on it. Rachel, or is this Paul?
Let me clarify that it's Paul speaking. It's not Rachel. Actually. Now what I was saying is now we're talking about One Health, and that One Health encompasses humans, animals, and even the environment as well. I was saying that there is a lot of struggle, especially in Africa, in terms of health system strengthening for humans alone. Now we're talking about One Health, and it's going to be very huge responsibility, you know. So I was saying, is there any mechanism that would support, you know, low-income countries, so to speak, to be able to measure up, you know, meet the realities of addressing One Health? And then adding to that also, what could be the role of community CSOs in terms of one, raising awareness, two, advocating for resources so that this One Health thing can be achieved at national level. I think that this was what I was trying to explain, to ask. Over.
So I see Marisa.
G, can you add me back for interpretations, please? I was disconnected.
Oh, okay. Do you want the French translation, Contiala?
Yes, I am Jean, so I was disconnected. Can you please add me back for interpretation in French?
Oh, okay. Mook, can you help Some with that?
Okay, RJ.
Thank you. Go ahead, Marisa, please.
Yes, thank you very much. Yes, so there is definitely a funding mechanism that you can reach, and I think the Global Fund is one of them. Global Fund is supporting a lot CSOs and engaging much more with the One Health approach and the PPR. I've mentioned also the pandemic fund, so countries apply to the pandemic fund to strengthen their system. So this is one of the few mechanisms that really have a system strengthening approach that can really support One Health system. And the projects that are developed for these two funds involve the animal health sector, because there is surveillance systems in animal health at the community level, which needs strengthening in some countries, which are very strong in other countries. Sometimes they help in detecting human issues in communities before the health system, it depends, and vice versa. So, and the environment is probably the one that has less system strong system approach and links with the other two. But there is definitely systems, the mechanisms, and they are increasing and being developed. And the role of your role of CSOs and communities is key. Because and for example, in the pandemic fund process and in the global fund as well, without the engagement of CSO, the projects are not granted. So there is a recognition of the key role and essential role of CSO in that. Having said that, it doesn't mean that your voice is very loud and clear at the national level, and this is things that we from the research side in Senegal, in Cambodia with Flavie, and in other parts of the world and countries with PRESOD, we're trying to look into more to be able to document that and show that your place is not, it needs to be strengthened, because this is the only way that we can really detect and stop an emergence risk from becoming a pandemic. It's in the ground, it's at the community level.
All right. Thank you, Marisa, for that answer. So now we're nearing the end of our discussion. So there's so much to talk about, but there's so limited time. But there's this last question, which I hope you can also use to share your final thoughts on the topic. There was this question on what PRESOD is doing to empower communities so that they become more resilient. So hopefully you can also tailgate that with some of your final inputs before we end the session. Maybe we can start with Flavie.
Yes. Yes, it's what we started. So under PREACT, under this program, in fact, we are starting to. So the example of this One Health community-based surveillance, for example, it's really to design something that is based on what's already existing at community level, used the way the system is working, and as well their proposition as a solution. So the idea is to co-construct with them based on what's already existing, their capacities as well, and to propose something which is suitable, which is as well sustainable as well by the communities themselves. So the idea is not to propose fancy surveillance system engaging like a lot of samples that are very costly. We need to have something which is useful for the community and sustainable. So this One Health community base that we started to develop in Cambodia, but in other countries in Southeast Asia and in other countries, it's under PREACT and under PRESOD, and it's really for that to have something more sustainable, more useful, and more based on the reality of the community, to make them to own the system, to have a better ownership of the system, and to be it's more useful for them. So that it's one thing, and the engagement as well, the fact that at the very beginning when we developed the project, the different projects, so like for PREACT, we are at the start of developing the program in other countries, like in Vietnam and in Philippines. And from the very beginning, the idea is to engage at the same table people that are leading policy and so, and people from the civil society sector, to have at the same level, at the same table, people with different voice that can propose some solution or issue to be targeted inside the project. And that is really what we are doing in PREACT and in the development of the activities.
Thank you, Flavie. Marisa, maybe a short concluding statement also.
Yes, I will be quick. So I think with all the examples that have been shown and what Flavie has said, so one key element that I will add is that often it is important to make the community realize that they have a role, they play a key role, because sometimes they don't even know, and that they can actually implement actions to protect themselves and to protect the rest of the world, but they need to know how. So when they realize they really have a role, they are interested in knowing how can they do it, and this is where we need to give key. And on the other end of the scale, we are ensuring that the policy that are being developed integrate their needs and constraints, because this is the only way they would be able to have this autonomy of acting and being recognized as essential to act.
Very important points from Marisa. Then lastly, Jean?
Oui, je voudrais, oui, parler vraiment de cette question du dialogue entre la science et la société. C'est-à-dire qu'on a vraiment besoin de deux types d'acteurs au niveau national et régional, d'organisations de la société civile, qui souvent interagissent aussi beaucoup avec les organisations communautaires de base, donc qui ont la capacité de vraiment faire remonter les besoins des populations. Ouais. Dans un pays comme le Sénégal, où une grosse part de l'État vient des donneurs, c'est vrai que l'État va avoir tendance à suivre les donneurs. Et donc, pour faire des politiques vraiment euh, qui intègrent l'ensemble des besoins, il y a vraiment, il est extrêmement important d'avoir un plaidoyer fort et des chercheurs et des organisations de la société civile qui souvent travaillent aussi ensemble sur un certain nombre de sujets. Donc c'est vraiment essentiel de pouvoir participer à faire remonter les éléments du terrain et de pouvoir participer à des actions de plaidoyer.
Yeah. Thank you, Jean, for that. And yeah, I think Jean already finished. Yes, we can hear you, Some. Some, we can hear you. So now, now that they've given us their concluding statements, so we're now nearing the end of our discussion. So of course, there's so many things to talk about, and we invite everyone to join our post-webinar discussion in our WhatsApp community page. So we invite you to share what are your key takeaways from the webinar. And here's the evaluation form for this session. So hopefully you can answer this form so that you can also receive your certificate of appreciation. We'll also make sure that this QR code is posted in the WhatsApp community page later. And then we also have social media channels where you can view updates and announcements on the next lessons. You can follow Apcaso at Facebook and on Instagram. And of course, we'd like to thank our partners from Prezode who gave us wonderful presentations. Of course, let's give Marisa a round of applause. So you can also use your clap emojis if you want. And also, we're very thankful for Dr. Flavie Goutard for her presentation. And also to Jean Caffin, who gave us an excellent presentation on Senegal. So with that, I'd like to invite everyone to turn on your cameras. We'll have a very quick photo opportunity before we end our session. So if you're comfortable turning on your cameras, our team would take a screenshot of our photos. So it's always nice to see everyone's faces. So even if we're online, we still feel somehow connected. I'll be sharing a slide later that contains the link to the WhatsApp group. They can just scan the QR later. Thank you for raising that. Okay, so Everyone all set? Mook, can you okay, so some people are still turning on their cameras. So we'll wait for a few more seconds.
So I'm going to start capture the picture on 3, 2, 1. Everyone smile. There you go. Perfect, lovely. And again, one more. 3, 2, 1, smile. Lovely. Thank you, RJ. Over to you.
All right, thank you, Mook. And again, reminding everyone of the WhatsApp community group, you can scan using this QR code. So I'll give a few seconds for you to join the WhatsApp community group. And also we'll share the articles and resource materials. We'll just need to ask permission from the speakers if we can share them. And then I'll post it in the WhatsApp group. Well, good. And yes, we had 91 participants for our lesson. So it's the highest among the 3 sessions. So good job, everyone. Thank you for attending our webinar. And I think that's it. Thank you for your participation. Thank you,